begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now this episode will be the first of a series on the common cold. I'm addressing the common cold before I get into the influenza series because by unanimous vote in the Acupuncture is My Life chat, many asked that I go over common cold and how acupuncture can treat this disorder. So if by chance you would like to engage in a chat session regarding acupuncture and whatever ailment you or your loved one may be dealing with, simply go to the Google Play Store and download the Acupuncture is My Life app to do so. Now back to the discussion at hand, and that being acupuncture and the common cold. Now the common cold is basically a viral infection which affects the upper respiratory tract. For the most part, is usually harmless. Now, children under the age of 6 are usually at a greater risk of catching colds. Adults on average can expect to experience cold symptoms, let's say, once or twice a year. Now, most individuals tend to recover from a common cold within 8 days, although symptoms can last longer in those who smoke. Now, symptoms of common cold usually present anywhere between 1 to 3 days after having been exposed. Now, symptoms usually vary between individuals, which can include cough, congestion, sore throat, sneezing, runny or stuffy nose, mild body aches, mild headache, and a low-grade fever. If a bacterial infection develops, you'll notice like nasal discharge that will be green in color as well as thick and viscous. So if you notice symptoms hanging around longer than expected or getting worse than you initially imagined, I would recommend you see your physician as soon as you can. I would also recommend you seek medical attention if your fever let's say exceeds 101.4, or the fever lasts more than 5 days, and if you begin to experience shortness of breath, wheezing, or a severe headache. Now, when it comes to children, I recommend to the parents to take their child to see their pediatrician if their fever exceeds 100.4 degrees Fahrenheit in newborns up to 12 weeks, or if there's rising fever lasting more than 2 days, or if the symptoms fail to improve, or if there's ear pain, wheezing, unusual drowsiness, lack of appetite, extreme fussiness, or severe headache and cough. Now, these are simply my recommendations for the record because I've encountered patients who come to see me seeking treatment after their condition had accelerated to levels in which I felt they either seek emergency care or the medical care of their physician. Now, it's good to see an acupuncturist in the early stages of common cold, or if you suspect a bad cold and flu season and would like to strengthen your protective chi, or should I say righteous chi, in preparation for the coming cold and flu season, which is usually best. Now, from a traditional Chinese medicine perspective, the common cold is generally seen as a disorder that's caused by an attack of an exterior pathogenic wind. The underlying pathologies to this disorder, usually a failure of the lung qi to disperse, as well as the protective qi not being able to consolidate the surface of the body. Now, two angles to be considered when it comes to common cold in Chinese medicine are either the presence of an exterior pathogen or pathogens considered as an exterior pathogenic influence, and the deficiency of righteous qi considered as an interior pathogenic influence. Now, for the most part, if your righteous qi is sufficient, exterior pathogens cannot invade the body via the protective qi, i.e., let's say strong resistance lessens your susceptibility to catching colds. Now, colds can be caused mainly by wind, such as wind cold or wind heat as an exterior pathogenic factor. The basic patterns of this disorder are generally, let's say, exterior wind cold, exterior wind heat, exterior summer heat dampness, pre-existing qi deficiency with invasion of exterior pathogens, or pre-existing yin deficiency with invasion of exterior pathogens. These are some of the patterns in which I've diagnosed over the years as an acupuncturist during cold season, with the exception of summer heat dampness, in which I'll go into detail about in future episodes. Now, my primary treatment principle for common cold is to basically release the exterior by inducing sweating. In upcoming episodes on acupuncture and the common cold, I will go deeper into diagnosing, or how I've diagnosed and treated this disorder. So don't forget to download the Acupuncture is My Life app at the Google Play Store to chat with us about this topic and any concerns you may have. And also don't forget to subscribe to this channel to stay informed as to when new episodes are available for you to watch. And another way you can learn more about acupuncture, simply go to the acupuncturismylife.com website and click on Understanding Acupuncture to read about the different functions of the organ channels in Chinese medicine and more, and also about yin and yang and its theory as well. Now, until next time, acupuncture is my life. What's yours?